Well, as COVID case numbers continue to surge here in Arizona, more kids are being diagnosed with something called Miss C. Maybe you've heard of it. Would you know the warning signs, though? Well, ABC15 is going in depth on this very topic. I was able to sit down with our ABC15 health insider, a pediatric infectious disease specialist, to find out more about this mysterious disease and what all parents should know.
The inflammation on the surface and the inflammation that is inside. So the inflammation on the surface usually presents with a rash, red eyes, sometimes swollen, cracked lips. You would see changes in the hands and feet.
As COVID cases surge in Arizona, more kids are being diagnosed with Miss C, or multisystem inflammatory syndrome, in children.
Less than 1% of kids who get infected with the virus, so less than 1 in 100 pediatric patients, if they have the infection, will develop this.
Some kids end up with this serious condition after they recover from COVID.
So this is a very small number when you're looking at the percentage, but when you have a widespread virus in the community, you are going to see some of those patients just when you do the math.
The infection triggered when a child's immune system revs up to fight the disease, but attacks the body's healthy cells instead.
MIS-C is not diagnosed without the fever. So that's the first thing that the parents need to look at. And then the other system that seems to be involved a lot in most of those kids is the GI tract, which is usually presentation of vomiting, diarrhea, abdominal pain.
Dr. Wasim Balam is a pediatric infectious disease specialist at Phoenix Children's Hospital. His mission? Fight fear by providing information to help parents spot the warning signs.
So these are the things that I would want you as a mom or as a dad to keep an eye on. If you feel like your child is not doing well, that's when you need to call and get the advice about how to proceed.
It's a gut instinct?
The gut instinct works in a lot of things related to pediatrics. They have a fever, they're not doing well, they're not, their happy self when the fever goes away, because, obviously the fever is not there 24/7. You give them some Tylenol or Motrin, the fever comes down, but they're still not feeling okay.
Miss C is not contagious, and Dr. Balam says it's treatable. He also says in nearly all instances, kids who get appropriate and timely care tend to make a full recovery.
The chances are low that your child will develop this, but we would want you to be on the lookout for that complication if it happens.
All right, so it's not impossible, but there is some hope here. Also, one of our missions here at ABC15 is to bring you in-depth coverage of the big issues. It is the goal of our ABC15 Health Insider series. We're diving deeper into the things that impact you, your health, the health of the people you love, by getting expert advice from people who know it, who see it every single day in their work, and those who also study it.